Dr. Day, thanks so much for joining me.
Oh, you're welcome.
Now we're speaking midday on November 20th. At this stage, all we have is media speculation, as well as a somewhat opaque video from the Premier of Alberta about pending legislation that would implement pretty significant changes, as we understand it, to how physicians work in the province of Alberta. Before we get into the legislation, why don't you talk, Dr. Day, about the status quo in Canada when it comes to how physicians are compensated for the work that they do?
Well, I think that, most Canadians would understand that the vast majority of doctors are um, independent, self-employed, responsible for their own operations, their own office expenses, and not salaried employees of the government. But there are some out there who, for some reason that I can't understand, expect that they should still give in to a system where the government orders them and compels them to only work for the government, uh, and yet the government won't give them the facilities or the resources to treat patients. So, one of the reasons we opened our clinic back over 30 years ago, or about 30 years ago, was that our operating time at the public hospital, when we used to have, myself and colleagues had 22 hours a week of operating time, progressively cut back to 5 hours a week. And yet we had 400 patients waiting. So this was deliberate rationing. And, we, as you know, we were in litigation for a long time.
Yes.
The BC Appeal Court, despite rejecting us, they said that the government is deliberately rationing access to healthcare in order to save money. And that includes, and even more surprisingly, they came out with the statement that this is inevitably causing patients to die. And yet this seems acceptable in Canada. And I think Canadians across the country are beginning to recognize that we are the only country in the world, like literally in the world, where a state-controlled healthcare system is all that is allowed by law. To me, that's remarkable.
Indeed. Now, as I understand it, Dr. Day, there are some provinces in Canada that permit doctors to fully withdraw from the public insurance model. But what distinguishes the reported or speculated legislation in the province of Alberta is it will permit a hybrid model whereby doctors will be able at the same time to build a public insurance provider and provide health services on a for-profit basis to individuals. Um, Help us understand the lay of the land and based on what reports have told us about the Alberta legislation, how the model would differ.
Well, one of the problems that government's facing is, I mean, Alberta surgeons are leaving Alberta on a regular basis to actually come to BC and see patients
Hmm.
privately, and that is completely allowed. Patients can cross the provincial. We don't have a Canadian health system. We have
Yes.
14 health systems,
Yes.
counting the federal and the territorial and provinces. And once you cross the provincial border, you are considered, quotes, a foreigner. So that at our clinic, I regularly operate on Albertans, and the clinics in Alberta, they regularly operate on British Columbians. This makes no sense. At one recent week of operating, or a day of operating. I was operating on 5 Albertans, and a colleague in Alberta was operating on 6 British Columbians. This
Hmm.
is nonsensical. Like,
Yes.
and we have all, an estimated up to 300,000 or more Canadians travel down to the United States yearly to get healthcare that they desperately want and are going to pay for. That makes no sense. That's a loss to the economy. And what we should be doing is, and I use the sports analogy here. It's pretty simple. If you're ranked at the bottom of the developed countries in access to healthcare, in efficiency of your health system, and especially, and a lot of Canadians don't realize this, we're one of the worst when it comes to access for low income groups. We are one of the
Yes.
worst of all developed countries. And and yet we're also in the top three spenders. This is nonsensical. And if you were a manager of a hockey team and your team was at the bottom and yet you were spending more than the teams at the top, wouldn't you think to look at what they're doing?
Yes.
To me, this is logic, and it's not. It hasn't been happening, but it sounds like Alberta is going to be leading the country in this regard. And I think there is no that you cannot have a moral issue with the fact that a government cannot a government that promises you healthcare in a timely fashion and then fails to deliver it cannot at the same time make it unlawful for you as a patient or you as a doctor to treat those patients. And the important thing also that needs to come is to allow which private health insurance, because we are the only country in the world in which private health insurance is illegal, except we have a private extended health. We call it extended health because we don't like the word private. But prescription drugs and ambulances and physiotherapy and dentistry, these are important services that you can only access by paying or having private insurance in Canada. Other governments in their public systems cover those services, other developed countries. And one of the points I like to make is this is not about rich and poor. The rich in every country are okay. They leave. I mean, the wealthy Canadians travel to get healthcare. So forget that. Um, but I take some lessons from the Netherlands and from Switzerland, where I lived in Switzerland for a while. And what they do in Switzerland, which is largely private hospitals and private insurance, is the premiums for private insurance for low income groups are paid by the government. So
Yes.
so that completely eliminates this two-tier rich for the rich argument, in that there's no reason why the government shouldn't fund premiums for low income groups in Canada and let them have the same private access. And people might argue, well, that's going to cost too much money. Well, actually, it will save money. One of the big fallacies about our health system is that it's saving money. It isn't. It costs more to not treat patients in a timely way. Sure, not in the 6 to 12 month timeline, but in the long term. We know, for instance, that in the screening test for breast cancer, if you diagnose breast cancer at an early stage, the total cost of the treatment is 1/10 of the cost as if you find it at stage 4. So it makes sense to diagnose quickly and treat quickly. And that's just breast cancer. The same applies to every other significant medical problem. It's cheaper to treat patients quickly in the long term, for sure. And governments tend not to realize that. Uh,
Yeah.
you know, I challenge anyone. We are in the only state monopoly on healthcare in the world. I challenge anyone to name a monopoly that serves the consumer of the service better than one that has a bit of competition. There is.
Yeah, well said. Well said. It isn't lost on me that many of the same proponents of our single payer first dollar coverage public insurance model are calling for greater competition in other parts of the economy in the name of improving consumer outcomes. There's a cognitive dissonance
Well, yeah.
that those instincts aren't applied to our healthcare system. Let me put a penultimate question to you. I'd be remiss if I didn't ask you uh, about a line of criticism that I think we can anticipate should the Alberta government proceed along the lines has been reported, and that is that as more and more physicians spend more of their time in private practice, it will come at the expense of the public system. Why, Dr. Day, is that line of thinking wrong?
Well, it's wrong because the government, the public system operates on a relatively fixed budget, and so it doesn't want to treat patients. So if you go to a hospital in Canada, unlike any other OECD country, you are consuming the hospital's resources. So
Yes.
hospitals deliberately ration, and the BC Appeal Court in our legal challenge said we are deliberately rationing governments are deliberately rationing healthcare in order to maintain fiscal sustainability. And the court followed that statement with the fact that this is causing patients to die. And we know at least 28,000 Canadians die every year on wait lists. And to me, it's unacceptable in a free and democratic society that we say it's illegal for them to use their own resources or to access private insurance to save their lives. That to me, that's just not acceptable.
Uh, Final question, again, with the caveat that we are speaking based on media reports of what may be pending legislation from the government of Alberta, having spent years both as a practitioner as an intellectual in this field, if it is indeed the case, and Alberta creates the conditions for this type of hybrid or dual practice model, what do you think the implications would be for physicians and for patients? Paint a picture of what that future might look like for
Well,
the residents of Alberta.
I think it will increase the number of physicians. When I came to Canada, we were second in the world in doctors per population. Index Mundi now rates us 76th in the world. And this is government policy that's created this. It's
Yes.
governments that closed medical schools in the 90s across the country.
Yes.
It's governments that cut back on medical and closed nursing schools. It's governments that close hospitals. This is what happens when you have a monopoly with a fixed budget. There is no reason why Canada shouldn't be able to recruit more and more doctors. I'm an immigrant doctor. Let good immigrant doctors who want to practice come here. But we even have 5,000 young Canadians attending foreign medical schools who should be allowed to have that training in Canada. But
Yes.
the governments have acted in a way that they don't want those doctors. So you can't say there's blame a shortage of doctors, use the shortage of doctors or nurses as an excuse when you created that shortage by deliberate policy.
Uh, a ton of insight in that answer as there's been throughout the conversation. As I said, we're speaking on November 20th. At this point, we don't have the details from the government of Alberta on what its speculated or reported reforms might entail. But Dr. Day, I hope we can draw on your experience and expertise in the coming weeks, because if these reports are true, this could be a significant moment in for healthcare reform, and we want to bring evidence and ideas to bear on behalf of our listeners and viewers. Dr. Brian Day, who, amongst other things, is the author of the book My Fight for Canadian Healthcare, a 30-year battle to put patients first. Thank you so much for joining me today.
You're welcome. Thank you.